Kylie Chambers is an occupational therapist by background with 20 years experience in the workers' compensation field, community rehabilitation and disability services. She has worked at Royal Rehab for the past 7 years, initially as an OT in aged care and disability, before taking a management role approximately 3 years ago. As the NDIS has developed, so has Kylie's role, and she now manages the driver assessment and training service and the multidisciplinary community therapy team for NDIS and compensable funded clients at Royal Rehab. While Kylie does not have the additional qualifications required of an OT driver assessor, as manager of the service, she is aware of all the client requirements in order to regain a licence following illness or disability. The driving assessment service currently has 2 OTs and 3 specialised driving instructors who are specifically trained to complete driving assessments and any training required. So welcome, Kylie, and this is a topic that has been requested because it is an area of confusion for a lot of people.
So I will talk about the general process. I will talk about what we do as a service. The process of regaining your license and the OT driving assessment process does vary between who does it. So it does vary a little bit. So I'll allude to what we do, but I'll also look at tell you what other services do as well and how you may get it, particularly because I understand a few of you are in a regional area as well. There we go. So as I've heard, a lot of you have actually already gone through this process, but it doesn't hurt to have a chat about why you would need to go through a process of getting your license. Someone's experienced that they were able to get it straight away. Other people needed to do a full assessment. Other people just needed doctor's clearance. So I'll have a bit of a chat about that and why it may be different for each person. What you need to do with your medical form, that's pretty much one requirement typically that you need, what the process of the assessment involves, what happens after the assessment, what are the potential outcomes, and funding about driving assessments, which is a big thing that's come into play, particularly in the last few years with NDIS coming about. So I'll chat about those things. Just to let you know, that picture that's on display is of one of our current vehicles, and that's got a spinner knob there in the middle as well, which is used to help control vehicle. So I guess everyone has a different rehab process for out of stroke. It does depend on what type of stroke you do have. So ultimately, when you're in a position to think about driving will vary for each person, depending on the nature of your stroke, what part of your body, how your body has been affected. A lot of the very common symptoms is left or right-sided weakness of the body. That obviously affects your ability to potentially control a vehicle, depending how much strength, function, range, and motion you've got. So ultimately, and the other aspects of stroke to aphasia, sometimes your ability to think quickly and react quickly is affected. And one thing that sometimes is a bit discounted is people's vision following a stroke, depending on what type of the brain has actually been affected. And sometimes that's actually missed during the rehab process because you're concentrating on getting your arms working better, your memory working better, walking properly, walking safely, not falling. That sometimes actually vision's not necessarily seen. And that's a big thing that sometimes happens with fairly commonly with some of our clients, is that actually their vision has been affected by their stroke to the point that their potential ability to drive can be affected. I'm not saying it is, but it's not necessarily picked up. So that's something that I guess just a factor in, and because it's one of the biggest components of getting your license back is making sure, and having a license, is that your vision needs to meet a set standard. The RMS, or now called Transport New South Wales, when we finally got used to saying RMS, Roads and Maritime Service, actually are quite strict on the vision requirements, even if you're very functional. Us OTs speak about function as opposed to necessarily diagnoses and conditions because everyone is different. But there is some pretty strict requirements in terms of your vision needs to meet certain peripheral vision and certain acuity, it's called. So all these things can come into place about your ability to return to driving after a stroke. And because of that, the first place of call is your GP or a neurologist or your specialist, I feel, to have a chat about it when you feel ready, or they hopefully will bring it up with you. So for that reason is because depending on the nature of the stroke and how it's affected you does depend on what you need to do. You were able and just needed medical clearance, whereas other doctors, other conditions, other situations will mean you need to go through more of a process or a specialist clearance. Some people can get cleared by their GP, some people need neurologist clearance, some people need other clearance, a vision specialist, and then some people need the OT driver assessment as well. So it really depends on the individual. An RMS driving test, that's another way you can get your license back. It's quite a strict, in terms of it really adheres to the, it's like getting your license originally as well. So there's quite a few ways. So in terms of your responsibility, it's actually the individual and your personal responsibility to notify the licensing authority, which is Transport New South Wales, if any medical condition affects your ability to drive. So it's actually your responsibility. Your health professional team can also notify them as well. So they don't have to. It's not a mandatory obligation for your team, but they may do so. But it is a personal responsibility to do that. And typically what they'd ask for is a fitness to drive medical assessment form completed by your doctor, which sounds probably familiar. I'm seeing a few heads nodding. And this form will talk through your vision, the problems you're having physically, any cognitive problems, so ability to think and your processing speed, and then what the doctor recommends. So that the doctor can clear you on that form to drive, as has happened in this case, can maybe put some restrictions on you, driving only in daytime. Talk to us about local driving. They can put an immediate restriction on a kilometre distance or daylight hours. Glasses is another restriction or condition as well. Or your doctor can ask for more information via a specialist or an OT driver assessment. Now, and I can understand doctors wanting to do that because obviously they see you in a clinic environment. They may be able to see how you move, even do cognitive tests, but they're not actually able to see you drive. So, and we all know that strokes can affect people very subtly and also in complex and very obvious ways. So the fact of the matter is that that's one of the safest ways sometimes to actually get your license back, is to be able to prove through the OT driving process. Your doctor can also cancel your license if they don't feel you meet the criteria. Obviously, I don't see that very often because my role is actually organising the driving assessment service, but it does happen. However, typically my experience is that the doctors would suggest a review in a few months' time and not actually mean that you're not actually able to get your license back. So it's more of a medical suspension type system. But they are all the options that they can do. Also, if you're over 85, they can also work in and 75 with the age criteria for licensing as well. So this is the form. It's not a very good copy, unfortunately, because it's just a photocopy. But on the left-hand side, you can see there's a few boxes, and so that talks about what option the doctor will do. So once you have this form, you would need to take it to your local Service New South Wales, which is the conduit for Transport New South Wales. Just a bit of a discussion point too. Service New South Wales, unlike the former old RMS, can't make all the decisions. They're front-facing staff and they do a lot of different jobs, and licensing is just one of them. So they will need to contact the medical unit behind the scenes and cross-check everything. So people may not get their license straight away, or they may only get a slip of paper or might get a conditional license or certain things. And then usually further information comes from the medical unit of Transport New South Wales in the form of a letter, depending on what the fitness to drive report does. So if it does say an OT driving assessment, what typically will happen if you present to New South Wales, to Service New South Wales, is that you would get downgraded. I think I've jumped ahead of myself here. Yes, get downgraded of a license to a learner's license, pending the OT driving assessment. But the letter really advising of that sometimes takes a couple of weeks to come. The biggest suggestion I make is take a copy of everything, because obviously this piece of paper is going to Service New South Wales. It then needs to get transmitted to the medical unit. The medical unit's based in Grafton, so it's not local to Sydney and it's not local to most locations. And it's also very helpful for to give to any other medical professionals. We ask for a copy for it at Royal Rehab because it gives us all the snapshot of medical information that we need to start. So yeah, so if you're cleared, you'll get your license back, get the new photo done maybe, and then a couple of weeks later, you'll again get that letter with your specific conditions if you do have any. As I said, you will maybe downgraded if further assessment is warranted. What that means is that you can only drive with a licensed driving instructor. Now, the licensed driving instructor doesn't need to be a specialised one like what I have in my team. It can be a standard driving instructor from, say, a driving school, but you can't just drive with anyone. Unlike a new learner who can drive with just mum and dad in the car, you'd have to drive with a licensed qualified driving instructor. So the idea of that is you need to keep your license to actually do the OT test, because we take you on the road, but you need to have someone who's experienced and understands things next to you. Now, the good news, as we were talking about before, is that just because you've been downgraded, you don't need to do the standard learner's test unless you haven't had your license for some reason for over, I think, 5 years, is my understanding. That tends to change a little bit, so I go by the Transport New South Wales rules, but my understanding is unless you haven't had a valid license for 5 years, you get downgraded, but it's for the purposes of having the license, appropriate license to do what we need to do to get you back to driving. And as I said, the letters come later because they come from the medical unit and they look at it. The medical unit have specialists, they have neurologists, they have optometrists, they have a specialist vision expert. I can't remember their title. They have all the gamut of people available to look and assess everyone's situation, and sometimes ask for further information as well. So if your doctor does say you need to do an OT drive assessment, which I think is what one of you alluded to before, you did go through the whole process. What does it involve? Well, the first thing is you don't need to wait for that letter from the medical unit. You can organise one straight away. And I suggest you do so. Some locations have a big wait list, particularly rural locations. There's not many OT driver assessors around. There is a good list of them though, and I do have one that I'll provide to Michelle after this to pass along your network so that you have got the contacts to make in the relevant area that you may need one. But my suggestion is to start researching straight away because there can be a wait. The OT Australia website also has a list of all the OT driver assessors as well, and we're a part of that list. So the OT driver assessment can be done in different ways. We do it as a clinic based at our centre, the way we're structured. So we have the meeting with you in our rooms and then we go around our local area in one of our vehicles. However, other OTs will happily come to your home, do the initial meeting, the discussion, interview at home, and then often will then come back with the driving instructor at another time to do the on-road component. So it varies for each person. Now, the one thing to make sure, not that I feel that any OT would ever do this, but the OT driver assessor OTs are specially trained. They do postgraduate qualifications to do this course. It's quite a specialised course. They're obviously looking at a lot of complexities, And they obviously want to help people get back to work, but then back to work, I keep saying that, so back to driving safely, and considering everyone around like the community, as well as what your experience is and why you want to get back to driving. It's so important as part of returning to independence. But just make sure that you feel comfortable that they can actually do the work. But there is that special qualification. They are also registered with the RMS, so you can ask for the, as I said, we've got the comprehensive list. OT Australia would obviously check that that everyone has got that qualification. Now, the other thing to mention in terms of the driving assessment is, unfortunately, there's no Medicare rebate currently available for it, and it is, as I said, the OTs are specially trained, the driving instructors are specially trained. You need to have a car with the passenger side brake. So it is an expensive service to provide. Every service will provide it at a slightly different cost, and I'll talk more about other funding a little bit later, but it is something that will cost you to complete in order to do so, because it's unfortunately not covered by any government rebates at the present time. So that's yeah, so it's just something to be bear in mind for, and something that we provide education to doctors and everyone about, because we understand that it's often it's at a time where you're getting your independence back. Often you haven't been able to work if you were working, and that's an important thing to consider as part of the process. So what do we do in the driving assessment? Is that we take a good intensive interview. It's about an hour to an hour and a half. We talk about driving history. We talk about medical history, how you've come to be in the situation of needing an OT driving assessment. Some people might have additional issues besides their stroke. We redo a vision screen, even though we've checked it in the fitness to drive physical screen, and we basically take everything through that during seated. We also do a cognitive screen, and the picture that is on the PowerPoint presentation is a picture taken from the cognitive screen, where you're looking at what's going on and interpreting who has right of way, who should be stopping, that type of thing. So there's a few series of that, and you need to respond to see which is correct. Those cognitive screens check your reaction time, check how your ability to adhere to the road rules. And there's also a road knowledge test as well, in addition to the on-screen assessment. And I've jumped ahead of myself again, but yes. So obviously we talk a lot about the symptoms, side effects. Medication's a big part of it. I'm not sure if anyone is still on medications, but particularly in the earlier days, maybe on some pain medications that make you drowsy, or other things that can impact your ability to drive. So that's considered. The other thing is, why do you want to return to driving? I think independence is one thing, but are you planning to return to work? How were you getting to around and out beforehand? What's your social supports? Because as much as we need you to get to a level where you're safe to drive, we also need to consider everyone's situation and what the impact is if you're not ready to return to drive. Again, I want to emphasize the vision screening. It's the one aspect that as OTs, we can only screen to a certain extent. We're not specialists in that area, and it's the one area that if we get to a certain point and we see that there's problems, we may need to ask for more information before we can actually proceed. However, that's in Royal Rehab, that's why we ask for good vision information prior to doing the assessment, to maximise the opportunities to actually get the assessment done. As I said, we do a physical screen. We look at how you'd get in and out of the car, how your function is putting on the steering, the seat belt, steering wheel. We go through all those movements so that we can anticipate what you will do well with and what you may have difficulties with the vehicle. Our cars have a range of modifications, and so if you have significant, say, one-sided weakness, we will kit up the car for the on-road assessment to adapt to that. And as I said, the cognitive screen, we look at, it's mainly computer-based to look at reaction time, communication and memory. Now, I didn't put in this specifically, but I guess we ask for try to ask for as much information before the assessment as well, because when people might need to communicate by different means, you might aphasia, you might have difficulty actually comprehending verbal or written. We will adapt this interview and cognitive screen, everything to meet people's needs as best as possible. And we will also utilise carers and family support to maximise that. Because just because you might not be able to communicate the same way doesn't mean you're not safe in driving. So we have adapted the assessment to be completely written at times, using lots of gestures and also the use of interpreters as well as needed, particularly, I guess, sometimes reversion back to one's original language does occur. We do look at the impact. So this is a standard assessment, and then we will adapt it accordingly and work, before we go on road, work out how we would communicate on road, because obviously that's a different scenario. So what happens after the off-road? As I said before, some people will do, and Royal Rehab does the whole assessment in one go. We feel that's a really good, clear way to do the assessment, and we want to give everyone the best opportunity to return to driving. Some people won't do well with the computer screen test, but actually are driving fine. Some people, might be have physical problems, but the modifications can overcome that. And also by doing it together, we get an idea of people's fatigue levels, which also gives us guidance in how to put any restrictions on people with the driving, but still enable them to drive. But others do it separately, because other providers often work by themselves, whereas we have a team already inbuilt into the service, and there's nothing wrong with that either. It's just a different point of how we do it. So as I said, the only time we wouldn't do it is if vision was affected to the point that we couldn't take someone on road, and then we would obviously look at getting that investigation and bring them back. So we will talk after the what we call the off-road or the clinic appointment about any concerns, any limitations, and what we might do to overcome those in the on-road test, such as modifications, such as we'll pull over every couple of minutes to check in what's happening. We'll concentrate on this. We'll communicate in this way. We'll do that to support you in the assessment. So it is called an assessment. Sometimes it takes a form of more of a lesson if you're learning to drive with some modifications. It is slightly different to an RMS practical test in terms of we don't, it's not an automatic fail in most scenarios, because we want to give people the opportunity to learn. Some people haven't been driving, I think a couple of people mentioned 4 or 5 years not driving, 2 years not driving. You're going to be rusty no matter what. So the on-road assessment has the client obviously in the driver's seat, set up appropriately, the driving instructor that's specially trained in the passenger seat, and the OT normally sits behind to the left, in the passenger left side. There is a brake obviously for safety concerns on the driving instructor passenger side. And our vehicles and most people's specialised driver training instructors' vehicles have a brief range of modifications to suit. We would cover most people if you have some ability to walk or transfer from a wheelchair. We would be able to cater to most people's needs, and also have access to more complex vans if we need to. So again, we have a preset route that covers everything we need to do. We're looking at tasks that you need to do, such as observation, can you scan, obviously controlling speed, your judgment, your reaction time, your ability to find your way through the streets, your ability to check the stop signs and the normal rules. So the driving instructor takes people on a route and then aims to ask them to try and get back. Now, we realise when we do it at Ride, sometimes it's unfamiliar, but that is life. You sometimes drive in unfamiliar locations, but we do take that into account in terms of people's experience and what they actually do with their driving day to day. And that's what we get from the clinic assessment as well. So we obviously start on quiet roads and then progress back to the busier roads to see how people go. We will provide, if someone does something slightly wrong, we'll provide feedback, and I guess that's the opportunity to learn from that during the assessment. So it is an assessment, but it's also about understanding that people haven't driven and can see that they can learn and return to driving safely. So after the assessment, there's quite a few different outcomes. One would be that, yep, you do everything really well, and you regain your license. So we notify the medical unit, we provide the report, and you're cleared to go. We provide a summary report to take to Service New South Wales straight away, so hopefully you can get that straight away. You might get your license back with some restrictions or limitations, such as the kilometres, such as daytime hours, those type of things. That might be what we recommend. You might, because of your physical requirements, need modifications. It might be as simple as a bigger rear view mirror. It might be spinner knobs, different accelerators, which I'll talk about in a minute. With that, you normally need to do some lessons in order to return to driving to get used to the modifications. And you'd complete those lessons and then go to the RMS, and they would check you on using those modifications. Sometimes if people are very rusty and their reaction time is not so good, just because they haven't driven for a long time or because that's how the strokes affected them, we might recommend lessons anyway, just because we can see that you've got the basics. You just need some practice, but need it with the driving instructor. And then we can either recommend that you get your license back or maybe a reassessment. Sometimes we will suggest that maybe right now, clinically and medically, things aren't quite stable and there's a few too many issues, and even lessons might not be in your best interest because everything costs and because you want to be successful. We might recommend a 6-month review and then return to considering driving. At times, we do also have to recommend cancellation of a license if someone's just really not safe and not able to recognise or adapt and take on the feedback. And we do sometimes recommend cancellation of license. But typically, if someone hasn't driven for a few years, we do provide the opportunity to learn, to regain that skills and confidence to be able to drive. So we use that as a last resort when there's really no factor of that ability to learn again, which is usually quite rare. So going through some common modifications that we use, particularly for people who've experienced a stroke. The left foot accelerator is very common. I hope you can see that picture. I have tried to highlight it. So basically the modification is an additional accelerator to the left of the brake, and then the right accelerator is actually covered. It's not very clear here because this is our assessment vehicle, so we have a lot of adaptations that pull in and out. And then you would learn to use your left foot instead of your right foot, which is affected, to brake and accelerate. And so that will usually require a few lessons. Now, the one thing to remember is that there are removable models of this. There's flip-up models. So all cars, when they're modified, can actually be re-put so anyone can drive it. So if you've only got one car for a couple, you could still have a modification, and it will just be removable or changeable. So it will flip up out of place if your partner or your child, whoever is driving the car as well. So this is a very common one that we use, and it's fairly, it's not too expensive in the scheme of modifications, which can get very complex. And it's a simple one, a very simple fix in order to compensate for someone who can't use their right foot, don't have the control that they need in order to drive safely. Spinner knobs is another common one. So the rules are that you ideally should have 2 hands on the steering wheel at all times. So a spinner knob is used when you can't do that because of one-sided weakness or problems. This is called a tri-spinner, so you kind of hold it, grip it like that, and you can see some buttons on it. They will control indicators, wipers, anything you can program it to control that. And so the idea is that you spin with one hand instead of having the 2 hands on the wheel and needing to use that. There's also different types of spinner knobs. So there's ones where you can actually put your whole hand in a glove in and use the gross movement, or a fork. So there's quite a wide range. to meet your needs. And we have quite a few that we would go through to work out the best one in that case. Now, one thing to mention too is that if you do need a modification, it pretty much rules out driving a manual vehicle, particularly hand controls, because and left foot accelerator, because obviously that's where a clutch would be. And also, if you need a hand control, you basically can't typically operate the gear stick safely. So that's one thing to consider. We don't see many manual assessments anymore. There's more and more automatic vehicles, but it can be done. It's just about sourcing the correct vehicle on hand. The other thing is that there's a lot of other things. If you've got just some general weakness, as I mentioned, mirrors, cameras, and sensors are now used, which help you out. If you don't have the neck motion, push button start, if you don't have the ability to turn the key very safely. Electronic brakes means you don't have to yank up a manual brake. There's lots of different things that new cars have that make it easier to do. The picture we've got here is a satellite accelerator. So this enables you to use two hands on the wheel, and that thumb that the person's got is actually controlling the accelerator. So that would be designed for someone that couldn't really use their lower limbs at all. So not common in stroke, but you never know. I often use with spinal cord injury clients that they would use that. And on the right-hand side, you can see a little lever, and that's the push brake as well. So there's quite a wide range of things, and a lot of them are quite reasonable nowadays to fit to most cars. I won't go through complex mods with the group we have here, but if someone is in a stroke, is in a wheelchair, but can drive quite successfully, there is many ways to actually stow a wheelchair. This picture has an arm basically coming out. So once you get in the vehicle, it will grab the wheelchair and put it in the boot. A lot of people have seen the ones that go on the roof, and there's a lot of complex mods that actually allow you to drive into a vehicle and into a driver's seat with a power wheelchair as well. That they start getting very pricey and very costly and involves a lot of work, but it is available now, which is fantastic, because probably even 10 years ago it was very, very minimal. So the question that a lot of people ask is funding. As I said, unfortunately, there's no Medicare rebate. I know SOTs will try to keep their costs as low as possible, but it is quite a comprehensive assessment. Can take face-to-face anywhere from sort of 2 to 4 hours, plus the report writing, plus the talking to the Transport New South Wales, plus talking to the instructor, and then you've got the instructor time. So it's quite a comprehensive assessment. Some private health insurers will rebate a little bit if you've got cover for OT, so you can check with that. Now, for those under 65 and eligible for the NDIS, typically the NDIS will fund the assessment, lessons, and any modifications. It just needs to be a relevant goal. Same with other compensable insurance-based schemes. Typically, we have been able to source funding to do the assessment to cover the costs. As long as you meet as I said, the criteria in terms of actually meeting the reasonable, necessary, and your NDIS goals. That's what it's all based on. We actually charge different rates. We try and keep our costs for those that have to pay themselves as low as possible. Working through the NDIS, if any of you are NDIS participants, it is a complex scheme that we have to negotiate as providers and use. So we do, while we try and keep costs low, we do charge differently to accommodate for the extra work and effort that we need to do to actually get the result for the client in that space. Because we're working with Transport New South Wales and their requirements, plus also NDIS requirements in terms of reports, etc. So I'm happy to talk pricing offline, but it does change, frequently, and it does depend on your situation and what you need. Now, the other thing I haven't put here, but I just thought to bring up in the case the fact that a lot of you have actually been through this process or a similar process and already returned to driving, is some of you may still need to, just another few thoughts I had was, may need to still put in yearly medical reviews. Some of you may even need to do reassessments for OT. And that can happen sometimes when people's conditions change, or just that's what the Transport New South Wales require. So it depends on the condition. Often the doctor will indicate, and hopefully once you go through your rehab journey, your condition stabilises and you don't have to do that. But that may be something that the doctor or Transport New South Wales requires you to do. So just to bear that in mind. If from a point of view of, we do have a few people that have gone through our assessment process that have degenerative conditions, and so conditions that deteriorate, and they factor in the cost of their assessment in their NDIS plan every year to help them out. So there's many ways that you can do it and work to your advantage, but if you do need to do it, it still will not come out of your pocket. And particularly, again, driving is about independence, is about fulfilling your life, working, taking family around, visiting family, doing everything for yourself. So to me, it's one of the ultimate items to keep if you can under an NDIS or compensable scheme. So it's very easy to justify to say, if I need to do ABC to keep my license, but this keeps my independence, this keeps me doing this, this means I don't need help in this area. It's a very easy justification in my book as an OT to get that funding to support people to return to driving and to keep driving as you need. So as I said, you'll get a copy of this presentation. I've put a few other useful links on there. Some of them are a bit more complex than others. And as I said, happy to help out in any way with personal situations offline as well.